Doctors in the US call pancreatic cancer a silent disease because it often only shows itself when it's already too late. Many men over 50 keep fishing, playing golf, and living as usual until one day they discover they have pancreatic cancer at an advanced stage. Here's the unsettling part. By the time most people find it, they've already overlooked clear signals their bodies were sending for months. Have you ever woken up in the morning feeling a heavy, uncomfortable belly and blamed it on eating too late the night before? Or watched your weight drop quickly and happily thought, it must be all that walking, then moved on? It's easy to shrug it off. After 50, most of us expect a few minor health issues. But the real question is, are those signals truly just aging? Or are they quietly warning you about something more serious? And why do even people who seem very healthy still fishing, gardening, playing golf, miss them? Doctors in the US often call pancreatic cancer a hidden disease because its symptoms are vague and easily mistaken for ordinary problems. The flip side is hopeful. If you recognize it early, your path can look very different, more healthy years with your family instead of letting the disease decide for you. You're not alone in this concern. Millions of people in their 50s and 60s around the world are asking, am I missing an important sign? So in today's video, we'll go through 8 early warning signs doctors want you to know. They may seem small, but catching them in time can change your future. Let's begin. The first sign is persistent abdominal or back pain. This isn't the kind of sharp pain that jolts you up at midnight to call 911. It's a dull, nagging ache that lingers in the upper abdomen and then creeps into the back. Many people think it's just an old back, age-related spine issues, or the price of years of hard work. A man in Ohio often felt back pain after gardening. He told himself, I must have bent over too long pulling weeds. But the pain didn't fade, it grew more persistent. When he finally went in, doctors found a small tumor in his pancreas, something he never imagined. Mayo Clinic physicians have emphasized that a dull, recurring backache can be one of the first signals of pancreatic cancer. If you're over 50 and the pain lasts for weeks, doesn't respond to usual remedies, and keeps returning, it's time to act. Early detection can mean you're back to tending flower beds and strolling with the grandkids instead of lying down with chronic back pain. The second sign is unexpected weight loss without trying. You're not dieting or doing intense workouts, yet the pounds come off quickly. Jeans that used to fit are suddenly loose. Shirts that once hugged now hang. A woman in Florida lost nearly 10 pounds in 2 months while eating the same meals as always. The reason? A struggling pancreas doesn't make enough enzymes, so food isn't broken down and nutrients aren't absorbed, even when you're eating well. It's tempting to celebrate effortless weight loss. But sudden, unexplained loss is a red flag symptom. Keeping your weight stable helps preserve your strength to walk with the grandkids and enjoy retirement without feeling depleted. The third sign is yellowing of the skin and eyes. Have you ever noticed a yellow tint in the whites of your eyes when you look in the mirror? Or had a loved one mention that your complexion looks darker or more sallow than usual? A pancreatic tumor can press on the bile duct. When bile can't drain, bilirubin builds up in the blood and turns the skin and eyes yellow. In the US, many patients first discover pancreatic cancer because of jaundice, not because of pain or weight loss. A woman in Florida went to the doctor simply because her eyes looked more yellow than usual. Thanks to that visit, her tumor was found early and treated in time. If you notice this change, don't stop at the liver or gallbladder. Ask your doctor to check the pancreas, too. It may be the difference between worry and a relieved, smiling face at your next family gathering. The fourth sign is digestive changes. After 50, many people accept bloating, indigestion, and stomach discomfort as normal. But frequent symptoms can point to something more serious. You may feel uncomfortably full after a typical meal, with gas and pressure in your belly. Your stools may be lighter in color, oily, or shiny, sticky, and hard to flush. That's a sign your pancreas isn't producing enough enzymes to digest fat. When fat isn't broken down, it passes into the stool, what doctors call fatty stools. A man in California ignored these signs for months, chalking them up to an aging gut, until an exam revealed pancreatic trouble. If these changes persist, don't blame age too quickly. Listening to your body and getting checked can help you enjoy backyard BBQs with friends without worrying about a bloated, uncomfortable stomach afterward. The fifth sign is persistent fatigue. You sleep enough, but wake up heavy and drained. Even a short walk leaves you winded and ready to sit down. Many pancreatic cancer patients describe this exact feeling. Your body spends enormous energy fighting the tumor, leaving you in a state of ongoing fatigue. A woman in Texas assumed, "I'm just getting older," until tests showed significant pancreatic damage. Unexplained, lasting fatigue isn't something to ignore. If it's become a daily companion, tell your doctor. Early detection can help you regain the clarity and stamina to fish, exercise gently, and enjoy outings with friends. The sixth sign is changes in appetite and nausea. Your morning coffee used to be a comfort. Now the smell turns your stomach. Favorite foods suddenly seem hard to swallow. After just a few bites, you feel heavy, queasy, and done. People often blame the stomach. But when the pancreas is compromised, digestion falls out of balance. Appetite drops, nausea rises, and weight can fall quickly. One patient in Seattle brushed it off for months, until the scale began to plummet. Tests then pointed to the pancreas. If you're losing interest in familiar foods or feeling nauseous after meals, don't dismiss it as just taste changes. Getting checked early can help you keep the simple joy of sharing meals at the family table. The seventh sign is diabetes that appears out of the blue. It sounds strange, but it's well documented. You've never had diabetes. Your eating habits haven't changed, and suddenly the lab says your blood sugar is high. Or you've had diabetes under control for years, and now it's suddenly difficult to manage. The pancreas makes insulin, the hormone that controls blood sugar. When a tumor disrupts that function, blood sugar becomes erratic. Studies suggest that up to 1 in 10 pancreatic cancer patients are first identified through newly diagnosed diabetes. If you're over 50 and suddenly develop diabetes without obvious risk factors, ask for a pancreatic evaluation. The eighth sign is unexplained blood clots. Your leg becomes swollen, red, and painful. The doctor calls it a deep vein thrombosis. Most people think of heart issues, blood pressure, or simply age. Few know that pancreatic tumors can alter the clotting system, making clots more likely. That's why many cases are first uncovered after a clot appears with no clear cause. A Johns Hopkins physician once put it this way: sometimes the clot is the map that leads us straight to a hidden tumor. If this happens to you or someone you love, don't stop at treating the clot. Ask for a deeper workup that includes the pancreas. It could give you the chance to intervene while there's still time. Those are the 8 signs doctors want you to know. Each one may sound small or ordinary, but recognizing them at the right moment can change everything. First, a dull, nagging ache in the abdomen or back that doesn't go away. Second, sudden weight loss without any clear reason. Third, a yellowing of the skin and the whites of the eyes. Fourth, digestive changes, bloating, greasy or pale stools, or feeling uncomfortably full after small meals. Fifth, persistent fatigue, the kind that lingers even after rest. Sixth, a loss of appetite is often accompanied by nausea. Seventh, diabetes that appears suddenly or becomes unexpectedly harder to manage. And eighth, unexplained blood clots that show up without warning. On their own, each of these might seem small or easy to dismiss. But when they happen repeatedly, when they last for weeks, or when several appear together, that's when your body is sending you a message you cannot afford to ignore. Catching these signals early can completely change the outcome. It can open the door to better treatment options, and even more importantly, it can give you precious extra years of health to spend walking with your grandchildren, enjoying your garden, or sitting around the table with your family. If you found this video helpful, here are 3 simple steps you can take right now. First, hit the subscribe button and turn on notifications so you'll never miss important health guidance designed for life after 50. Second, share your story in the comments. Have you ever experienced any of these 8 signs? Your words may help thousands of others realize they are not alone. And third, pass this video along to your spouse, your friends, or family members. Sometimes just one reminder, shared at the right time, can help someone catch a silent disease before it's too late. Always remember, you are not on this journey by yourself. We're walking it together. I'll see you in the next video, where we'll explore the everyday eating habits that can strengthen your pancreas and help your body thrive well into your 50s, 60s, and beyond.